responsibilities for keeping people safe, also fully fleshing out the safer at home and our vast great outdoor safety requirements to make sure that folks in all sectors are able to return to work in as safe a way as possible. Before we get to that, I want to thank the General Assembly, acknowledge that their work has come to a close just moments ago, which is why we're a few minutes late. 3 members of the State Senate, 3 members of the State House came to my governor's office and informed me that they were adjourning. And I told them, and I want to share with everybody, how much we should all respect and be grateful for the public servants, the Republicans and Democrats, who really maintain the integrity of our republic under extraordinary conditions. Those extraordinary conditions are not only the pandemic itself, but also the fact that there were gunshots and of course, thousands gathered right at the steps of the Capitol as they went to work. A member who had served the better part of 2 decades told me how it devastated her that there was graffiti and defacement of our public monuments. But at that same time, what is so important is what goes on inside those hallowed halls of representation at our state capitol, and the fact that our state legislature completed the state budget, did their important work, including coronavirus response, did it in a safe way, that showed the people of Colorado that even in challenging times, we will not sacrifice democracy. I want to thank them in particular for extending and funding the reinsurance program to save people money on health care for 5 years, and extending those savings to additional families and providing more coverage options, particularly in the areas of Colorado that had been the highest cost. I also want to thank them for referring tobacco and vaping tax to the ballot to help shore up our schools, and ultimately to provide free preschool to every child who wants it in our great state. I'm also pleased that they closed some tax loopholes for millionaires and will help be able to use those resources to support our schools and provide tax relief for hardworking families through the expanding the earned income tax credit. I also applaud the efforts to provide paid sick leave to every Colorado employee. Salaried employees take this for granted. Many of you watching might say, I get sick leave. You know what? Most hourly workers in Colorado don't, and they risk having to go to work with a bit of a cold or not getting paid, and that is very dangerous during a pandemic, and even in normal times, of course, is a big way that the flu and colds are spread. We want to make sure that if people are sick, they're able to stay home without giving up their paycheck, and now that will be the law in Colorado. Important legislation to preserve and protect our air was reaching my desk, and the General Assembly also used the coronavirus relief funds for housing assistance, for utility bills, for support for small businesses through loans and grants, including those who weren't able to get the Paycheck Protection Program, and to help those who are struggling with mental illness or domestic violence. And of course, the General Assembly, Republicans and Democrats, responded to the call of the moment to reform policing in our communities and help rebuild the trust between law enforcement and our communities. I also want to thank the Joint Budget Committee, who had a very difficult task. People don't run for office to make difficult and challenging cuts to support programs they care about, and they did it with great professionalism, listening to the voices of those who were affected, and they balanced one of the most challenging budgets in state history. And for those watching, you might not know, our state has a balanced budget requirement. Unlike the federal government that can deficit spend every year, our state, rightfully so, strongly supported, requires that the legislature prepare a balanced budget. The governor signs it. I obviously intend to sign that budget. And they did it in a very short time frame, in a very professional way, and made those difficult decisions. So I want to thank the members of the Joint Budget Committee. I want to thank Speaker Becker, President Garcia, for their partnership and work during this important time, and thank the minority party for their work in joining together to respond to the call of the time on the policing reform bill, and the fact that tobacco and vaping, closing tax loopholes, had bipartisan, these all were bipartisan, had bipartisan votes for them, keeping with the spirit of Colorado to show how we work together, and that what brings us together and unites us is far greater than what divides us. And that's a good tone in these challenging times to set for our entire state. With regard to coronavirus, we're at 29,299 positive cases, 1,600 and 5 deaths of people with coronavirus, 1,373 people who've died of COVID-19 in our state. And I want to take a moment, of course, to express my condolences to the families of all those who've been affected. We continue with good news in Colorado. The news is only as good as people's behavior, wearing masks and staying 6 feet apart keeps up, and it is, but that is borne out in the news. 12 of the last 14 days have had a downward trend, and 8 of the last 14 days have had a downward trend in new hospitalizations. So both moving the right way, which is really a proud testimony to the decisions that individual Coloradans are making, the responsible decisions to wear masks in public. And we've learned even more that mask wearing is even more important than we even initially thought a couple months ago with subsequent studies that have been done. And their best to stay 6 feet apart from others in social activities, economic activities, and in recreation. And we have a number of important announcements today. First, a new round of safer at home guidelines to really further relax the restrictions on areas that were too specific for the first safer at home experience. I just used the example of, we were one of the first states to open salons and haircuts. We required, rightfully so, both the person doing the haircut or nails and the person receiving it to wear a mask, and that's had a tremendous effect. There's been no cases that I'm aware of that spread at all through that way. But what that didn't take into account is there are certain procedures like facials, doing work on somebody's face, or even a shave for a man, where the person receiving it obviously can't wear a mask. And so that is something, in getting everything going, we wanted to get everything going safely, and now we can refine it. So now there's a way where, yes, the person administering it can have the right facial protection, but a person can receive a facial or a shave in a reasonably safe way. And we're trying to get back to at least some way to do all the normal things we do. Everybody knows if we go back to how we did them in January, the virus will take off immediately again. In fact, we are only just a few steps ahead of this virus here. We see some of our neighboring states, Arizona and Utah, that are moving the wrong way rather than the right way. And we will only continue to move the right way as long as Coloradans continue to be responsible, to wear masks in public, and exercise precautions, staying 6 feet away from others where they can, and for Coloradans over the age of 65 to show extraordinary precautions, enjoy being safe at home and in the great vast outdoors, and be very careful in areas where there are others. And second, we're going to lay out today the long-term sustainable framework for how we can enter the protect our neighbors phase in areas of our state that have low viral count, very little or no community transmission, and are ready to re-enter the sustainable phase, meaning the phase that is the way we have to live until there is a vaccine or cure, remaining on guard, but certainly with additional degrees of normalcy that allow for the activities that make life worth living, while we continue to work hard to stay a step or two ahead of this nefarious, tricky, and deadly foe. In terms of the new guidelines, I'm not going to walk through every detail. They are published, and I want to indicate whenever we're doing this now, we've been able to get to the point where we put them out, and then we accept public comment for several days. So these are all draft that are being out today. We hope to finalize them by the end of the week, but they are up online, and we are accepting public comments for the next few days on how we can even further refine them to make sure that people can engage in all the activities that we enjoy in a reasonably safe way. All of the rules that we are announcing today are going to go in effect by the end of this week. Residential summer camps will be able to open with 10 kids indoors, 25 kids outdoors. Summer camps have already been open for a few weeks. My daughter has really enjoyed her art camp last week with a group of 10 or less, and in a reasonably safe way. The overnight camps will now have, and the CDC issued some precautions that, and they're very consistent with the work that we're doing around those as well. Indoor events, a lot of folks really been asking questions. How can we go to conferences, receptions, museums? They already were able to open, but this is a more workable way that they can open in a reasonable way. Some have opened through what we call variances. Others have opened under previous guidelines, but this is more the sustainable way that they can open. Just guidelines that are consistent with the CDC and recommend 6 feet of separation from groups at these kind of events. And also allowing for the very large facilities, right? And when rooms are very large, where you have a bigger radius, you can have up to 75 people per room, and then for rooms that are double size, up to 100 people per room anywhere in the state. So it's a way that we can get back to more normalcy. Restaurants, houses of worship, life rights, higher education. These kind of activities need a way that they can function without jeopardizing the lives of those who attend. Now, to be clear, there's a risk in all activities, and some Coloradans will choose not yet to re-engage with these activities that do put them at risk, and that is a wise course to take if you're over 65 or have a pre-existing condition. But there are others that might be averse to taking that risk of all ages, and we support that and acknowledge that. For those who choose to take that minor risk, we want to make these activities as safe as possible. And that's why it's important that people wear masks when they're in public and stay 6 feet apart from others. We cannot yield to this virus. Our ongoing vigilance is what will allow us to continue to stay a few steps ahead of the virus in Colorado, as we struggle with it nationally and internationally. Bars will be able to open up to 25% or 50 people indoors. They can have more space outdoors, of course. Many have patios. Personal services will now be able to do the few things they weren't able to do: facials, beard trimmings, lip waxing, where the client has to take off a mask as long as the worker is adequately protected. And then non-critical, the manufacturing facilities are going to be coming back with more folks too. Many of them have been back in a limited way, but we want to make sure that our manufacturing sector is fully back in a way that respects social distancing and the number of folks that are in a room at any particular time. So that really completes the Safer at Home. You can find out a lot of the details at coloradosaferathome.com. The new guidelines are open for comment for 48 hours. And these are really just dotting the I's and crossing the T's on our statewide approach on how every type of activity can occur in some way. Now, that leads to the next step. A lot of areas are ready to go further, and in doing so, there's a shared responsibility between local county health, local elected officials, local businesses, and the state. This is a marathon, not a sprint. Our challenge is to manage the spread of coronavirus so we never enter one of these exponential periods like we had in March, while also making sure our economy can grow and that we have the Colorado we love. Masks are the ticket to the Colorado we love. Being 6 feet apart from others makes an enormous difference in enhancing our freedom. As the Surgeon General of the United States said yesterday, masks are really the ticket to freedom. And no state is perfect, and you know, I would love to say that every Coloradan is perfect, but I do want to applaud that, by the way, so far, Coloradans have done a great job. Really a great job. I mean, this is not a function of what the government is saying or doing. It's not a function of what your local county health is doing. What it is a function of is your responsible decisions you make every day. And by and large, the proof is in the pudding. Coloradans have been following the sound guidance of health officials in large numbers, wearing masks in public, staying 6 feet from others, and that is why we are here with good news instead of bad news. I hope not to be the bearer of bad news, and that really depends on our behavior as individuals to be responsible, save lives, protect our economy, protect our freedoms. Now, we can't let the good news so far give us any kind of false sense of security. We know that things are going to get more challenging. Could be sooner rather than later if our behavior lapses. We see that in neighboring states, or it could be a second wave in the fall, which much of our modeling shows. And of course, we're also concerned about the overlap of COVID-19 with the traditional flu season, which in bad years also has a tangible impact on filling our hospital beds. This is all about hospital beds. It's all about making sure that every Coloradan who needs care to save their lives can get that care. And that goes for heart attack, strokes, COVID-19, or flu. If we're doing our job as Coloradans, we're making sure that we're maintaining that capacity to help make sure that every Coloradan who contracts COVID, who has a heart attack, who has appendicitis, has the very best chance to get through it that modern medicine can provide. And yes, this double alignment of COVID and the flu season will be an extra challenge for our hospitals, and we need to carefully navigate a path that balances the need to control the novel and unprecedented virus until there's a vaccine or treatment with all of the other conditions that we need. And that's why we're going to be focused on outreach around how we can reduce the impact of the flu season as well, including encouraging more Coloradans to be vaccinated against the flu. And a lot of the same social distancing precautions that, of course, have proven effective so far in COVID-19 will also be effective against the flu. It's really critical among individuals that we continue to wear masks. You've probably heard me say that a couple times today. The studies that have come out in the last few weeks show an even greater importance to wearing masks than our scientists originally thought a few months ago. The more that we wear masks in public, the more that we deliberately try to be 6 feet apart from others when we interact, the more successful we will be and the greater our economic activity will be. And on the government side, of course, we need to continue to acquire personal protection equipment, expand testing and tracking and tracing, and ensure hospitals and public health agencies are able to meet the need of the surge of folks. But we need to find a sustainable way to live. We've known that from the start. Make sure that individuals, businesses, local government have the certainty and predictability they need. And from the very start, we knew that we live in a big, diverse state with large, dense cities, with sprawling, booming suburbs, with small resort towns, with rural agricultural areas, with wide open spaces. And I was proud that we were the first state to allow for local flexibility through the variance process. And that has been very successful in areas of the state that have a low virus count. They were among the first areas in the entire nation to be able to safely reopen their restaurants and many of their local businesses. We now feel that we can take that further, tailoring solutions at a local level in areas of our state that are ready to meet the protect our neighbors phase, which we laid out in our initial response to the coronavirus. Stay-at-home phase, we were one of the first states to end that phase. Safer at home, that longer-term sustainable phase, everything's back in some way, not necessarily in the way we like. And protect our neighbors, which is the way we live with the virus until there's a vaccine or cure. And that's why we're announcing today the next phase of the framework, protect our neighbors, how counties can get there and what it means. This is draft. Everybody will comment. It'll be refined within a week or so. So moving forward, communities can demonstrate that they have strong public health care, strong healthcare systems, paired with low virus levels and encouraging trends. So they need to show their capacity. Can they do the testing? Can they do the tracking and tracing? Do we have the virus currently under control with very limited to no community spread? And has the trend been good? And there are communities that will be able to meet that in Colorado and enter the protect our neighbors phase. This additional flexibility is very important because if a public health agency can scale its ability to do things like site closures when there's an outbreak, testing and case investigation, and contact tracing now, they are the first line of defense instead of statewide or regional setbacks to the progress that we've made so far. In other words, strong local public health and healthcare systems are the key to successfully reopening our economy. And if the key message in March and April was we need to flatten the curve, now we have a new message. We need to exercise personal responsibility. Wear masks in public, stay 6 feet apart from others, and support our local public health efforts to contain this epidemic so that we can continue to enjoy our freedoms. Now, briefly define these three levels, both the conditions that need to exist and what it looks like for society at large. You all remember stay at home. And Coloradans did an amazing job, which is why ours was one of the shortest in the nation. That's where people had to stay at home whenever possible, except for essential activities. And effectively, it's a mass quarantine, something that policymakers and elected officials and businesses want to avoid at all costs. But it successfully stopped the exponential spread of the virus in our state, saved thousands or tens of thousands of lives. Thank you for doing that so well. And because of our success, we were able to, sooner than many states, end the stay-at-home order and begin a safer at home time when our economy was going and everything more or less is being done, but those over 65 need to take additional precautions and stay at home. We incorporated the great outdoors where people can be spaced out and have fun in our beautiful June weather, and that there are additional safety precautions around the types of economic and social activities that we enjoy. That's what we have been in. And then finally, protect our neighbors. This is where communities can enter protect our neighbors when the virus is well contained, when local public health and healthcare capabilities are scaled to a level that can respond effectively to future outbreaks. That's the goal. Stop those outbreaks at the site level. That could be a factory, could be a school, could be a neighborhood, could be people who attended a particular church, could be people who work in a particular business. When you have that outbreak, contain it at that level so it doesn't come countywide or statewide. And to do that, our public health partners at the local level need to make sure they have the ability to do the contact tracing, the isolation, the quarantine, the site-specific closures, the enforcement of public health orders. In order to enter protect our neighbors, communities need to qualify by meeting the scientifically established thresholds of lower disease transmission levels, being able to treat patients and handle a surge in their hospitals, and conduct testing and effective case investigation, contact tracing, and outbreak response. This is very important because if we can empower our local public health agencies and partners to meet the needs of communities across Colorado, then we truly can rely on these tools to flatten the potential second wave and reduce further outbreaks by nipping them early in the bud instead of having to employ extreme stay-at-home or shutdown efforts regionally or in various areas of the state. Communities in the Protect Our Neighbors level will have a strong underlying public health that allows them to permit all activities to occur with spacing at 50% of pre-pandemic capacity, up to 500 people in one setting at a time, which means that if counties are ready to enter Protect Our Neighbors, there might be some county fairs in Colorado. In fact, I think our own State Fair Commission is considering how they might have both an in-person component and a virtual component. We know we can't live as we lived last year, and we will someday when there's a vaccine or cure. I hope it's within a few months, hopefully by the end of the year, early next year. But in the meantime, that normalcy in a reasonably safe way, again, I always use the word reasonably safe because if you want to be safe, you stay at home or in the great outdoors. But, for people who want to take that additional risk, be smart, wear a mask, and then these guidelines will allow us to be able to have something closer to a normal, sustainable way of life in our state. Local or regional agencies have flexibility with a broad statewide framework to how to prevent virus transmission. Over time, the 50% threshold can even be increased in regions that continue to hold their transmission levels steady and show that they can do that for a period of weeks and demonstrate that they're also capable of the testing, contact tracing, and treatment that is needed to be able to maintain success in the Protect Our Neighbors phase. So how will we know what community qualifies for what level? Well, a team of scientists in my administration, as well as at schools of public health, including academic experts, public health directors, epidemiologists, have been hard at work developing a set of measures to help us understand how we successfully move between these phases. Looking at questions like, what's the level of transmission in a community? What percentage of tests are positive for COVID-19? Are hospitalization trends increasing or decreasing? How are we tracking and tracing cases to be able to isolate people who are exposed or close sites that are exposed before they become community-wide outbreaks? I'm really thrilled and relieved to be releasing this framework today, but most of all, I'm grateful. I'm grateful that the people of Colorado have thus far succeeded in wearing masks in public and staying 6 feet apart whenever possible. And I know that doesn't mean every Coloradan. We hear stories and anecdotes of people who aren't wearing masks or who are gathering illegally, including in my home county of Boulder, where kids who were proud of graduating CU partied on the Hill, as they do every year, and inevitably several of them have come down with coronavirus. It's a direct result of human behavior. Human behavior is all that separates us from failure or success. And I'm grateful that Coloradans have thus far been successful in social distancing and staying 6 feet from others where possible, in wearing masks in public. And with that gratitude, we are now able to present the full plan for areas of our state that are able to enter the Protect Our Neighbors phase, as well as complete the work around safer at home and in the vast, great outdoors. As we gather stakeholder feedback, the scientific community will be hard at work, along with stakeholders and businesses and individuals, to be able to launch the framework for Protect Our Neighbors by the end of the month. Hopefully going live in the first counties by the first week in July. So to recap, we have a number of policy updates today to Safer at Home. We've also announced that what the reopening plan looks like longer term, the partnerships with how communities that shore up and strengthen county health can enter Protect Our Neighbors as soon as the end of June, early July. And you know what? Public health agencies, our state and local, they deal with outbreaks all the time. Now, many times it's hepatitis, it's mumps, it's norovirus. I was in Grand Junction earlier this year. Their superintendent there calls this in Mesa County the year of the virus, because it's not just coronavirus. They actually had to shut down their schools over norovirus, which was a very dramatic virus, which led to throwing up and spread very quickly, much more minor than coronavirus in that it resolved itself within a day or two, but it was very dramatic, obviously a dramatic onset and symptoms, not threatening to people's lives. But they've had two, and county health jumped right on it. They were able to shut their schools for a week leading into Thanksgiving, clean them. All the kids went back, and it was under control. And public health deals with outbreaks all the time. Now, this is much bigger. This is much bigger than 20 cases of mumps in Summit County, which is kind of what public health expects. And that's why it's taken time for the state and for public health departments to gear up, to be able to scale up, to be able to do that. Now, we've slowed the spread. You've slowed the spread. That's amazing. Now we can continue to give local governments even more flexibility, as we've done with granting variances, in partnership with strengthening that local public health ability to contain any outbreaks early and prevent the pandemic from gaining another foothold in our state. Ours is a state that believes in local control, and with local control comes local responsibility. And I think we all agree that, an outbreak in Sterling doesn't mean that Mesa County should be shut down for a month. And this is what success is going to look like going forward until we have a vaccine or cure, is partnering with stronger local public health efforts to be able to protect our neighbors in a sustainable way and have that Colorado we love back. And until we can all embrace one another once again when there's a vaccine or cure. The key to success continues to be individuals making responsible choices, choosing to wear masks, washing your hands regularly, avoiding touching your face, keeping 6 feet from others when possible, limiting interactions, staying home when sick, so important, staying home when sick, getting tested and isolated if you yourself are positive, and cooperating with the contact tracing work where if you have COVID-19, making sure that those who might have been exposed can be notified. And yes, our local government, our state government, our federal government continuing to do our part, getting the personal protection equipment and testing supplies, growing the ability to test and track and trace, ensuring that we have additional surge capacity in healthcare, and making sure that we have broad compliance across our state, and handling upticks and outbreaks and surges at a localized level so that we can try to avoid any catastrophic measures in the future that leading to great loss of life and great damage to our economy. With that, I would be happy to take some questions.
Governor, given that other states are seeing rising cases, are you nervous at all about opening up this new phase? And also given that you talked about last week the concern about the spread of coronavirus among protesters, and we haven't been the 2-week span yet, so we don't even really know the effects of that. So aren't there a lot of unknowns to be opening up everything like this?
Well, to be clear, what's happening today, what's happening today is dotting the I's and crossing the T's on safer at home. And that just means these relatively small things that were just not focused enough to be covered by the guidance. So I use the example of, salons have been doing everything, but there just wasn't a legal way where they could do, shaving or facials. Now there is. Day camps were back, but overnight camps weren't, and now they have guidelines that are consistent with CDC. So this is not a major change in June. It is certainly making sure that the small items that were missed, and I would add they might be small items to us, but for people who that's their vocation and that's their livelihood and that's how you put food on the table, these are very important items, right? I mean, if you're a counselor at a summer camp, or your kids value that outdoor experience, or you give facials to people and you've been out of work and your unemployment's running out, these are very, very important. So that's what's happening now, Jesse, is just those dotted I's and crossed T's for the relatively small sectors, but very important to the people involved, that just didn't fit under the broad safer at home guidelines. The second thing that's happening today is we're announcing the path forward for Protect Our Neighbors. No one is in Protect Our Neighbors now. We hope that they get there and they meet those criteria. The rules will be finalized by the end of this week, and then we are certainly all very hopeful that parts of our state will be able to get there in early July. I am deeply concerned, very worried about developments in neighboring states. Arizona and Utah are showing high growth levels of coronavirus. Colorado continues to be stable, to a slight downward trend, and that will continue if Coloradans continue to make the right choices individually, wear masks in public, and stay 6 feet apart from others when they can. Telephone?
Hi, Governor. This is Kara Mason. Today I'm asking about Southern Colorado specifically. Parkview Medical Center confirmed to me this morning that they've laid off 22 people, and I think there may be more because of fiscal impacts from the pandemic. This hospital not only serves Pueblo, but the entire southeastern Colorado region. What is your administration doing to keep the healthcare systems outside of the metro region from deteriorating?
Well, first of all, I'm encouraging patients that need treatment to go to the hospital. You should not be scared away from getting the medical treatment you need just because you're worried about COVID. Our hospitals are taking extraordinary precautions. If you have chest pains, if you have dizziness, if it's something that you would have gone to the hospital for in January, you should go to the hospital now. I mean, whether it's calling an ambulance if you live alone or having a spouse or loved one drive you. We do not want to discourage anyone from seeking the medical care they need. So that's very important message, because that's essentially what's happening is patients in non-COVID conditions have either continued to defer procedures they need, aren't necessarily going in with the same frequency, and that too can be dangerous and unsafe. And it's really important that Coloradans seek the medical care that they need. I would point that's kind of what's actually happening to some, not every hospital, but some. Now you're talking about kind of the overall piece. I would say I'm grateful that we passed the reinsurance program. This will help many Coloradans afford to have health insurance. So you ask any provider, having people fully insured is a key part of them having a business model that allows them to continue to exist. When people are uninsured and they give uncompensated care, it's a huge hit to their bottom line. If they're underinsured, it's a huge hit to their bottom line. They don't even make a lot of money off the government insurers, Medicare or Medicaid. They really rely on that commercial insurance. And that's what this does through reinsurance, is it will allow many more folks who don't get insurance through work to be able to afford to be fully insured. By bringing down those rates, 20% or so is what they were brought down. This new piece helps those who get more subsidies on the exchange. So the medium-low income will now be able to afford health care even more. And I can expect that we hope to reduce the amount of uncompensated care in our hospitals, which will, of course, reduce the anxiety of patients about how they pay for it and reduce medical bankruptcies, but also help shore up the viability of our providers. From the room?
Do you have any sense of what's different in Colorado from, say, Arizona or Utah, the states where we're seeing cases spike, and in Colorado where we're not seeing it? What's different?
Yeah. So first, what's the same? The virus is the same. Same virus in New York, same virus in New Jersey, same virus in Utah, Arizona, Colorado, Europe. The only variable is human behavior. So this virus is here. It's present in our community. The minute that human behavior lapses, that people aren't wearing masks, that they're congregating, this will resurge back. It's the same virus. It behaves the same way. So human behavior is a variable. And Coloradans thus far have been extremely responsible wearing masks in public, being 6 feet from others where they can, reducing socialization, staying at home. People over 65 doing an even better job staying at home. And as long as that continues, I'm confident that we can continue this positive trend.
Yeah, about mask wearing in Colorado versus other states, any public health?
I wish I had that. The recent studies have shown that mask wearing is even more important than we thought. That's not Colorado specific. It's COVID specific. It's the virus. There's been 3 or 4 different studies in the last couple of weeks that have showed that mask wearing, we knew it was effective, but it's even more effective than we thought, especially coupled with social distancing. There's, some communities in Colorado require people that shop to wear masks, others don't. Whether it's required in your community or not, it's the smart thing to do. It's a smart thing to do for your own life, for the life of your loved ones. It's also the smart thing to do if you value freedom, if you value economic growth, because really how fast and how far we can go depends on how well people are doing social distancing and wearing masks. And thus far, they've been doing a great job in Colorado, as is borne out by the data.
Hello, this is Meg Wingeter from the Denver Post. You've talked about how communities will determine that they're ready to these lower phases. Is there anything set for the other direction if they start seeing an increase in local transmission of when you need to kick in the more restrictive versions?
Yes, and by the way, Protect Our Neighbors also contemplates that several counties can band together to pool public health resources and tracing and tracking and testing, and in many areas of our state, it makes sense for them to do that. It also, we believe that with the tools that public health will have in place, they should, operative word being should, be able to stop a new outbreak at the site level. Now, if despite all the preparations they don't succeed at that, then they risk lapsing back into a safer at home type environment instead of the Protect Our Neighbors environment when they have a negative trend and for a number of days a certain viral load that continues to exceed it, and their measures are not being effective. So they are the first line. They have the first chance to address a trend in the wrong direction. They've demonstrated to us that they have the tools to address it, and we're confident that they will address it. But if they fail to address it or the trend continues to move in the wrong direction, counties would backslide from Protect Our Neighbors back to safer at home or in an extreme life-threatening situation to stay at home.
Governor, you talked about the success that Democrats had in closing tax loopholes, but just a few days ago here, you were talking about how you didn't think it was possible to even reach that compromise. Certainly there are Democrats in the legislature who think that we should have gone further and recouped more money and gone faster with tobacco taxes. Can you talk about how you guys got to that point where you were able to sign up on this bill, but also if you share any concerns or what you would say to those legislators who say you had the opportunity to do more and didn't?
Well, I'm thrilled that my pessimism wasn't warranted. At the moment in time, I was pessimistic based on the breakdown of negotiations a week before. But to their credit, the legislators and folks involved worked closely with us to create a package, including tobacco revenues, which under a initiative that was filed by the citizens of Colorado would have gone to preschool initially, which is a big priority of mine. But I was very supportive of efforts to delay preschool starting for a couple of years because of the urgent need to fund our schools and existing health programs. And so that was the compromise that was reached, along with eliminating a tax loophole that only benefits joint filers with over $1 million in income, and with that revenue going half to tax reductions through EITC and half to be able to support our schools and budget. So, like many legislators, I am hopeful that there's a bigger deal to be had in the future, a way that we can work together to reduce special interest tax loopholes. But the most urgent part of that work, particularly the part of that work around some tax revisions that were one-time only, and that had they not been acted on, would be gone, not available for next session. I'm grateful that we're able to work out a agreement with the legislature that really rises to the challenge of these times, and I'm particularly gratified that it was bipartisan. The tobacco and the revenue piece were both had support from both Democrats and Republicans.
Governor, this is Dan Micah from BizWest Media. Last night, Governor, can you hear me?
Yes, please, go ahead.
Yes, this is Dan Micah from BizWest Media. Last night, Larry Kudlow, the director of the White House National Economic Council, said that the Trump administration is planning to allow the additional $600 in federal unemployment per week on top of the state UI benefits to expire on July 31st. I wanted to get your thoughts on how you think that, if that does come to pass, what that means for Coloradoans who are still waiting to return to work or may have been permanently laid off.
Well, right now you see sort of political posturing on both sides around what the next federal package will look like. We're grateful for the CORES Act, the first one. The House passed the HEROES Act. The President, Larry Kudlow, they don't want the HEROES Act, but they are supportive of a $1 trillion plus program. And so what you're seeing is, and you will see in the coming weeks, are some positioning and posturing on both sides, hopefully driving towards a tangible final deal in July, we hope, that really helps restore economic stability across these great United States, including in Colorado. And part of that discussion will certainly be shoring up unemployment, looking at what a long-term package looks like that encourages people to get back to work but realizes that others have lost their jobs. And that'll be the challenge that I'm confident that the Republicans and Democrats in our congressional delegation are up to. I talk weekly with our representatives and senators. We do a bipartisan call every week, sometimes twice a week, to make sure that they are closely in touch with the needs of Colorado individuals and businesses. Yes.
On the
I'm sorry. Do you have one? Someone in the back? No? Okay, go ahead.
So on the testing, do you feel like people are availing themselves of the testing, that they know it's there, and I mean, more people could get tested if they were showing up, right? Or do we
well, yes. I mean, the first benchmark that we had set out for ourselves is everybody who's symptomatic can be tested. We've reached that benchmark. In any testing system, you need to prioritize symptomatic, and everybody who's symptomatic can be tested. Now, beyond that, there is some capacity to test people with no symptoms. You could call it asymptomatic, you could call it pre-symptomatic, but many of them might be contagious without knowing it. We have focused that in two ways. One, we have focused that effort proactively around testing those who work in senior facilities and nursing homes. We've done that through deploying the Colorado National Guard, and we've done that in partnership with Colorado State University. And that has been effective in preventing site outbreaks at senior centers. The second way are through I think we're at 48 now. I'd have to check the number, free community testing sites across the state, Pepsi Center right near here. And we've encouraged, for instance, people that have attended the marches, the protests, to get a free test. They're eligible. They just say, I attended the protest. They can then get tested. And those who think they might have been around a lot of people are exposed, including frontline workers, grocery store workers, restaurant workers, and others. Last telephone question.
Hello, Governor. Jesús Carrasquel, Noticias Univisión. Gobernador, según un estudio, 82,000 familias de Colorado están atrasadas con los pagos de renta. ¿Qué pasará cuando termine la orden ejecutiva que firmó el sábado? Y por otro lado, gobernador, muchas personas de la comunidad aún se preguntan si los nightclubs y los salones de eventos están abiertos al público.
Sí, dos preguntas, ¿sí?
Yes, sir.
Sí. Primer pregunta. Yo hice un orden que todas las personas que alquilaron sus casas tienen más tiempo para pagar su renta. Ellos normalmente tienen solamente 10 días antes de una evicción, pero ahora ellos tienen más que 30 días para pagar su renta, más tiempo antes de evicción. La segunda pregunta, con las reglas hoy, los clubes y bares pueden abrir con capacidad limitado. Y estas son las reglas en forma preliminario hoy, pero vamos a finalizarlos antes del fin de semana. Y es una vía seguro como posibilidad para abrir sus negocios. Thank you so much, and thank you to the people of Colorado for wearing your masks and for staying 6 feet from others. Let's keep it up, and we'll have a robust and strong recovery, and we will save lives, and the life you save could be your own. Thank you.